Ovarian cancer is the seventh most common cancer among women in the U.S. It occurs most frequently in women who are between 40 and 65 years of age. We asked Dr. Lisa Abaid of Hoag Memorial Hospital Presbyterian in Newport Beach about the treatment options.
Ovarian cancer is a form of cancer that arises on the ovaries. Women have two ovaries. Most cancer from the ovary arises on the surface of the ovary, and because of that is at risk for spreading relatively quickly to the rest of the abdomen. And in fact, most of these cancers are caught at stage 3, which implies spread. So one of the big areas of research is looking at detecting early ovarian cancer, and warning signs and different types of screening methods are being investigated.
We asked Dr. Abaid how ovarian cancer is treated.
The first step in treating ovarian cancer is typically surgery. During surgery, the goal is to remove all visible signs of cancer, which sometimes involves removing part of the intestine, the colon, the spleen, sometimes part of the diaphragm, certainly the uterus and the ovaries. That would be followed by chemotherapy, typically between 6 and 18 months of chemo, depending on some of the risk factors and the type of cancer. Every now and then we have patients who are not candidates for surgery at the time of their diagnosis. Either they're in very poor health or they have had a recent event like a stroke or a heart attack, and there are times that we do start with chemotherapy first to try to shrink the tumor down, give them some relief from their symptoms, and then do the surgery between 3 and 6 months after starting chemotherapy.
We asked Dr. Abaid how successful the treatments for ovarian cancer are.
We're very good at getting ovarian cancer into remission. About 3/4 of women will go into remission, meaning there's no evidence on an exam, on a CAT scan, on a blood test, there's no evidence of cancer. Of those women that go into remission, about half of them will come out of remission at some point, and coming out of remission almost always means that the cancer is not curable. And so that is another area that we're working very hard to try and see why we have so many women who come out of remission who must have some microscopic cells hiding behind or left behind after the initial treatment, and how we can cure more women. We can get them into remission, but we want to keep them in remission, and that's the challenge.
And Dr. Abaid told us about the newest research being done.
There's actually very exciting research going on in looking at the properties of cancer cells and ways that we can develop treatments that will target cancer cells and spare normal cells. Traditional chemotherapy targets any rapidly dividing cell, which is why it targets hair cells and bone marrow cells and cells that we don't want to be killed by the treatment, and it has a lot of side effects. The newer treatments called targeted therapy or biologic treatments are aimed at exploiting weaknesses in the cancer cells that are not found in normal cells and trying to target your treatment to the cancer cells. So I think that over time we're going to have treatments that are more effective and less toxic for our patients. The second area of research where I think that maybe not in 5 years, but maybe in 20 years that we might see some real change is in trying to develop treatments that are specific to somebody, to an individual tumor, and looking at those cells and tailoring treatment so that we know with more accuracy what's going to kill a particular woman's cancer, rather than giving the standard treatment that's given to everybody, which is how we do it right now.